Let me tell you about a patient I saw not long ago. She was 67, active her whole life, walked every morning, stretched every evening. But when she came into my office, she could barely sit still. A sharp, burning pain was shooting from her lower back all the way down her leg. She looked at me and said, "I don't understand. I'm doing everything right. I'm stretching every day like they show on YouTube. Why is it getting worse?" If you are over 60 and dealing with sciatica, sudden lower back jolts, or that electric burning sensation running down your leg, I need you to pause with me for a moment. Stop copying those random stretches you see online. Stop forcing your leg up to your chest because someone half your age said it fixed their disc problem. I say this with care, not criticism. You are not doing anything wrong, but your spine at 65 is not the same spine as someone at 30. Here's what most people don't explain clearly. The majority of back exercises you see online are designed for younger adults with herniated discs. In younger spines, the discs are plump, hydrated, and thick like fresh sponges. When they bulge backward, certain extension movements, like arching the back, can help push that bulge forward and relieve pressure. That advice works beautifully for many 25 or 35-year-olds. But after 60, your spine changes naturally. The discs lose height. They dry out a bit over time, like a sponge that's been left on the counter. The spaces between your bones narrow. This narrowing is called spinal stenosis, and it is incredibly common as we age. Arthritis can also thicken the joints in the back. So when someone over 60 aggressively arches their back or forces themselves to stand up straight with military posture, they may actually be closing the very space their nerve needs. Think of your nerve like a garden hose. Now imagine someone stepping on that hose with a heavy boot. The water flow slows down. That boot is compression. And every time you force an arch in a spine that already has narrowing, it can feel like you are pressing that boot down harder. My goal today is simple. We are going to gently remove that boot. Before I show you the movements, I want you to understand one key concept. Picture your spine as a stack of small bones with little windows between them. Those windows are where your nerves exit. When you were younger, those windows were wide and open. Over time, they can become smaller. If you arch backward, those windows narrow further. If you gently round forward, what we call flexion, those windows open up. For many people over 60 with stenosis, flexion is relief. And that brings me to the first movement I teach almost every older patient with this kind of pain. The first exercise is what I call your bedside emergency reset, the single knee to chest. This is perfect first thing in the morning when your back feels stiff and tight or at night before sleep. Lie flat on your back. You can do this in your bed. Place a pillow under your head if that feels better. Bend both knees so your feet are flat. Take one slow breath in through your nose, and as you exhale, allow your lower back to gently settle into the mattress. Now slowly lift your right foot. If your knees are healthy, hold just below the kneecap. If you have knee pain or arthritis, slide your hands behind your thigh instead. Gently draw that leg toward your chest, not forcefully, not aggressively. Just until you feel a mild, pleasant stretch in your lower back or buttock. Hold it there for about 5 seconds. Breathe in. Breathe out. Let your shoulders stay relaxed. Then slowly place that foot back down. Now, switch sides. Lift the left leg and gently pull it in. You might notice one side feels tighter. That's normal. Pain is often asymmetric. Be patient with the stiffer side. Hold for 5 calm breaths. Then lower it down. If that felt relieving, you can try bringing both knees in at once. Hug them gently. This position flattens the natural curve in your lower back and often opens those nerve windows even more. Some people like to rock gently side to side, almost like you're giving your back a soft massage against the mattress. Repeat this sequence, right, left, both, about 8 to 10 times. Move slowly. There is no prize for speed. The goal is comfort, not strain. Many of my patients tell me they feel relief within minutes. The second exercise focuses on lubrication and gentle rotation. I call it the windshield wiper. Stay on your back with your knees bent and feet flat. Walk your feet slightly wider than hip width. Stretch your arms out to the sides in a T shape to stabilize your upper body. Now slowly, let both knees fall to the left side. Don't force them to touch the bed. Let gravity decide the range. Keep your right shoulder gently anchored down. You should feel a comfortable stretch through your right hip and waist. Bring your knees back to center using your abdominal muscles. Then let them fall to the right side. Keep your left shoulder down this time. This movement nourishes the joints. It helps pump fluid into stiff arthritic segments. It also gently mobilizes areas that get locked up from years of sitting and guarding. Move slowly, left center, right center, about 15 to 20 repetitions. Breathe in as you come to the middle. Breathe out as your knees drop. Think of it like rocking a baby. Smooth, calm, rhythmic. By the end, your hips and lower spine should feel warmer and looser. The third exercise is incredibly powerful, especially if lying on the floor is difficult. I call it the diver. Sit on the edge of a sturdy chair. Plant your feet firmly on the floor. Spread your knees wider than your hips. This is important. You need space for your torso to come down between your legs. Place your hands on your thighs. Tuck your chin gently toward your chest. Begin rounding your shoulders. Slowly slide your hands down your legs toward your knees, your shins, maybe your ankles. Let your back round naturally. Let your head hang heavy. You don't have to reach the floor. You are not trying to win a flexibility contest. You are simply allowing gravity to gently decompress your lower spine. Stay there for 3 slow breaths. Imagine the air filling the back of your ribcage. With each exhale, allow yourself to relax a bit deeper. To come up, walk your hands back up your legs. Stack your spine slowly. Lower back, middle back, shoulders, then head. No jerking upward. Repeat this 5 times. Many of my patients use this during the day if their legs start to feel heavy or numb. It can be a lifesaver for stenosis-related symptoms. Now, exercises are powerful, but they are only half the story. I also see people unknowingly undo their progress every single day. Let me point out 3 hidden mistakes. First mistake, chasing perfect posture. You were probably told your whole life to stand tall, chest out, shoulders back. But if you have spinal narrowing, forcing an exaggerated upright posture can increase compression. A slight forward lean while walking is not weakness. It is often your body's intelligent protective mechanism. Don't fight it aggressively. Second mistake, heroic walking. Walking is wonderful for you, but if your leg starts going numb after 10 minutes and you grit your teeth and push through, you are irritating that nerve more. Walk until mild discomfort begins. Then sit down. Do the seated forward fold we practiced. Rest briefly. Then continue. Walking with breaks heals. Walking through sharp pain inflames. Third mistake, sleeping without support. If you lie on your back with legs straight, your lower back may arch all night. That closes the nerve windows for hours. Place a pillow under your knees. It flattens the lower back gently and lets the nerve rest. If you sleep on your side, don't let your top leg fall forward and twist your pelvis. That twist strains your lower spine all night long. Place a pillow between your knees to keep your hips aligned. It seems simple, but this alone has transformed mornings for many people I treat. One final rule I give all my patients. Pain is information. During these movements, you should feel better or at least no worse. If pain sharply increases, travels further down your leg, or feels electric and intense, stop. Choose a gentler option. And remember, sometimes sciatica is not just about compression. It can also be about weakness. Weak gluteal muscles, weak core stabilizers. These increase the load on your lower back. In our next discussion, I'll walk you through exactly which muscles need strengthening and how to do it safely without flaring your symptoms. You are not fragile. Your spine is not broken. It has simply changed with time, as all living tissue does. When you understand those changes and work with your body instead of against it, relief becomes possible. Take your time with these movements today. Be patient with yourself. Healing after 60 is not about force. It's about wisdom, consistency, and listening to your body. Stay steady, stay hopeful, and most importantly, stay kind to your spine.